Trumbull County Mental Health and Recovery Board is turning 50 this month. The people working there have been in the news a lot lately because they're at the forefront of the opioid crisis, but they deal with a lot more than just drug overdoses. Here's First News anchor Stan Boney.
The Trumbull County Mental Health and Recovery Board, as of this month, is turning 50. A lot of times when we hear about this board, all we talk about is the opioid crisis, but the Mental Health and Recovery Board does a lot more than that. Joining me now is the executive director of the board, April Caraway. When I said that, that is true, too. You do more than just opioids, right?
Yes, we do. We do mental health services, prevention in the schools, addiction services, all kinds of things.
When it started 50 years ago, what was the purpose at that point?
50 years ago, it was a combined board with developmental disabilities, and they did mental health and services for people with disabilities. And then they split off, and they have their own board, and we have ours. And we've always been a combined board with mental health and addiction services.
Now, when you talk about mental health, what kind of services do you provide?
We pay for counseling, case management, medication for people with mental health needs who don't have insurance. We also do crisis intervention in the hospitals if someone's in a mental health crisis. We train police officers on, responding to someone in a mental health crisis. Lots of trainings. We also do debriefings. Like when Justin Leo died, we did debriefings with a lot of the first responders and hospital staff who were struggling.
Now, when it comes to mental health, one of the big issues right now is in the schools. Have you always been in the schools?
We pay for services in the schools. So we are a staff of there are 10 of us here. But we pay agencies who have certain certifications and credentialing to provide the services in the schools, in the hospitals, out in the community.
Talk about the recovery end. That's a whole different part too, right?
Right. With recovery, we talk about mental health recovery and addiction recovery because, people can get better and they can live functioning lives if they work their programs, maybe stay on medication, whatever they need.
Is it the same thing? You provide free services for people that can't afford it?
Correct. Our board levy and state funds pay for services for people without Medicaid or private insurance.
Where do you think a board like this is going to go over the next 50 years?
Over the next 50 years, I think, unfortunately, we're going to be needed, and we'll probably be needed more. Every year we seem to focus on additional things. Once we get past the opioid epidemic, there always seems to be a new drug that comes along.
April Caraway, thank you very much. Once again, the Trumbull County Mental Health and Recovery Board this month is turning 50. In Warren, Stan Boney, WKBN 27 First News.